Hey, Dr. Matt here with Plaza Dental. I just wanted to go over some post-op instructions related to tooth extraction. So what can you expect in the first 48 to 72 hours? So you can expect some mild bleeding around the surgical site, some pain, swelling, or even bruising of the surgical site, the face, or the jaw is totally normal. So let's kind of go over the main things related to post-op care. So it's really, really important that we don't disturb that area for about 72 hours. You can control any bleeding by applying pressure with gauze. If bleeding is persisting, you can actually change the gauze out for a tea bag. There's just some natural coagulant factors in the tea that actually can help stop the bleeding if you're having issues with that. Other things you can do is ice the surgical area by applying it to the side of your face. Within about the first 4 hours of surgery, you can apply it for 20 minutes on and about 10 minutes off. The biggest thing we want to try to avoid post-surgery is something called dry socket. And so there's kind of the 3 S's for dry socket, and these are the 3 things to avoid in those first 72 hours. So drinking through a straw. Straws can create pressure in the mouth that can dislodge that blood clot and lead to dry socket. Any sort of spitting or vigorous swishing, that can dislodge the blood clot as well. And then the third one is smoking or vaping. And again, that's all about creating that pressure that can dislodge the blood clot that can lead to dry socket. It's really important that you avoid any vigorous exercise or heavy lifting for 72 hours. And it's also really important that you eat a soft diet and you avoid any of the following of these foods. So salty foods, acidic foods, spicy foods, brittle or crunchy foods, and it's not a food, but alcohol. All of those things can really irritate the surgical site and cause delayed healing. If sutures were placed, they will dissolve in about 1 to 2 weeks. If a bone graft was placed, it's totally normal to feel little pieces of bone particular granules in the first few days after surgery. That's totally normal. However, if you do feel like a big glob of bone graft or something like that come out, give us a call right away. We may need to replace that bone graft. So as far as pain management goes for after your extraction, the general protocol, if you're able to take ibuprofen or Motrin, is to take 1 tab of that 800 milligram Motrin your doctor prescribed you every 6 to 8 hours, kind of as needed for pain over that first 3 days. If the pain is not going away with just the Motrin, you can take it along with 1 tab of 500 milligrams of Tylenol, and you can take that together. So they act together and it can dramatically decrease the pain. If your doctor prescribed you a steroid or any other pain medication, just take that as directed. And if your doctor prescribed you any sort of antibiotics, make sure you take that as directed and take the full course of antibiotics. Just don't take a few and stop just because you're feeling better. We want to make sure we get rid of all that bacteria. So as far as next steps, we always want to see you back for a 1 to 2 week post-op visit. This visit is just to evaluate the healing, to make sure everything's going okay and there's no infection or issues with the extraction. And then if we did place stitches or sutures, we'll remove those if they haven't dissolved by then. If a bone graft was placed, we'll schedule you for your 3-month follow-up to have your implant consult to make sure everything healed appropriately so you can get your implant. And then if you had an extraction and a temporary bridge done at the time of extraction, we'll schedule you for your final impression 1 to 2 months out. So when to call us? If you have severe pain or swelling that does not resolve or is getting worse after about 48 to 72 hours, if bleeding does not stop within those first 2 to 3 days, or if you feel you may be having an adverse reaction to any of the prescribed medications. The other thing to call us about, of course, like we mentioned before, is if you feel like your bone graft came out or dislodged. And again, if you think of any question that we didn't answer at the time of treatment or in this video, just give us a call at 720-870-9500.